ChatGerry, Glucose Stability Without Medication, a Longitudinal CGM Case Study No. 1511, January 22, 2026. Gerald C. Shu, EclaireMD Foundation, Category Diabetes Control. Preface: This paper stands alone. I restate key background so readers can understand it without reading my other papers. I was diagnosed with type 2 diabetes in 1998 after a glucose reading above 360 mg/dl. In the years that followed, I experienced 5 cardiovascular events: severe kidney disease, neuropathy, and near-blind diabetic retinopathy. These events forced a complete reset of my life in 2010. I stopped all other professional work and began full-time self-study of internal medicine, starting with diabetes. From 2010 onward, I relied only on lifestyle management: no diabetes drugs, no vitamins, no supplements. I used strict food portion control, limited carbohydrates and sugar, walked daily, monitored glucose continuously, and managed sleep and stress. I maintained this approach consistently for many years. Introduction: On June 21, 2025, I suffered a hemorrhagic stroke. After the stroke, I began taking 1,000 milligrams of metformin daily. This created a clear before and after situation that allows direct observation of whether medication changed my glucose control. Glucose data and observation: I examined 2 long continuous glucose monitoring CGM periods using the same Libre device with 96 glucose readings per day. The first period spans 7 years. From July 1, 2018 to June 20, 2025, with no diabetes medication. The second period spans 7 months. From July 1, 2025 to January 22, 2026. With a daily metformin dose of 1,000 milligrams, the results are simple. The average daily glucose in both periods is about 113 mg/dl. During the lifestyle-only period, my average daily glucose was 112.91 mg/dl. During the metformin period, it was 112.77 mg/dl. There was no meaningful difference. Glucose ranges were narrow during the shorter post-stroke 7 months period, which is expected. However, there was no downward shift in average glucose after starting medication. In fact, the weekly average showed a mild upward trend after the stroke, despite metformin use. This comparison is not based on days or weeks. It spans 7 years versus 7 months, using the same device, with identical lifestyle rules. Lifestyle context: My food intake and carbohydrate control did not change after the stroke. 2 things did change. After stroke, I slept about 3 hours more per day. My walking steps dropped to about half of my usual 15,000 steps, despite more sleep and less activity. My glucose level stayed the same. This stability occurred both before and after starting metformin. Pathophysiological interpretation: In plain terms, long-term glucose control depends on 3 things: sugar from food, sugar made by the liver, and how well body tissues use sugar over many years. Strict lifestyle control can bring these into balance. In my case, food control reduced sugar input, regular walking improved sugar use by tissues, continuous monitoring reinforced consistent behavior. Over time, my system has adapted. When this balance is maintained long enough, daily glucose swings narrow. The system settles into a stable range. Under these conditions, adding metformin does not lower average glucose further because liver sugar output and insulin response are already controlled. They no longer determine my glucose level. After the stroke, stress hormones, nervous system imbalance, reduced activity, and brain recovery demands would normally push glucose higher. The fact that glucose did not rise suggests that the underlying metabolic control remained intact. Metformin likely helped buffer these new stressors rather than lower glucose further. Interpretation based on results only: If metformin were the main driver of my glucose control, average glucose should have dropped after it was started. That did not happen. The most direct explanation is that my glucose control had already been achieved through long-term lifestyle adaptation before medication was added. This conclusion is based on observed output over time, not on theory. What this does and does not mean: This does not mean metformin isn't effective for others. It means that in my case, glucose control is behavior-driven, not drug-driven. Conclusion: 2 long continuous glucose monitoring CGM periods, 1 without medication for 7 years and 1 with metformin for 7 months, show nearly identical average glucose levels. My glucose control was established before medication and remained unchanged after medication. The data speak clearly. Disclaimer: I write this paper not for fame, but to share what I have learned so others can understand their health, prevent disease, and live longer, healthier lives. This content is provided for educational reference only and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered or republished as your own. All intellectual property rights belong to the author, Gerald CHSU.